which are almost always there for that one. But the other stuff is kind of iffy whether you see it or not.
Yeah.
You do see the androgens and estrogens pretty consistently increase, though. Yeah.
So they have increased androgens with a woman who has PCOS?
Yes.
Why?
Why?
Yeah, because I don't understand how can you have PCOS and have problems like menstruating if you have increased androgens?
Hang on, what was your second question?
Like, I don't understand how you can have PCOS and have problems menstruating if you have increased androgens.
Well, it's not necessarily like.
Androgens don't necessarily make you menstruate.
Oh.
Androgens are more male hormones.
Yeah.
Okay, you're gonna have to forgive me on my biochem because it's been 8,000 years. But basically, if you're going through, and this is the adrenal gland, by the way, right? It's on top of your kidney.
Yeah.
Where this is happening? Not in your ovaries. Okay, that's different because in your ovaries you're getting from your brain, pituitary, you're getting your LH and your FSH, right? And LH is definitely increased in PCOS, but here you're getting these like what the freak is it called? Some kind of like from cholesterol. Cholesterol is going to turn into some kind of progesterone, which is going to blah, 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 and it's going to go one way and turn into androgens, which are male hormones, right?
Yeah.
And then I think the other way is going to be into estrogens, and these are the female hormones, but you end up increasing both of them because you're increasing that whole system somehow. So the androgens increased and the estrogens being increased really have nothing to do with the increased LH, but that's a negative feedback because it's trying to kick the egg off of the ovary that's not working right. And then you do end up, for some reason, you tend to have low progesterone too, probably because it's being shunted too fast this way. So there's a lot of hormones that go into this, a lot of biochem that goes into it, but they're different, I guess is what I'm saying. This is an ovary issue over here, and these are also part of the syndrome that happened in the adrenal gland. Because all that has to do with the whole cortisol thing too, in different ways. Hormones are being shunted from one way to the other. Does that make sense? Okay. Alrighty. It also obviously has something to do with the pancreas too, because of the whole insulin thing that sometimes happens too. So it's a systemic thing. Okay? You decide to start your life over and sign up to go to Sri Lanka to work on a medical mission team. All is well, you're happily treating patients. Over time though, you begin to cough more and more, producing large amounts of sputum, having uncontrollable night sweats, fever, and fatigue. You decide that mission work isn't for you and rush back to the States for treatment. A biopsy is done and Casey's necrosis is identified.
Tuberculosis.
Yeah?
D.
Hey.
It's D. Although they need multiple treatments for antibiotics.
Anybody have a problem with tuberculosis?
Necrosis, people.
What about you? You got a problem with tuberculosis? Because it's that caseous necrosis, and because it's in your lungs, it's very moist.
Stop! It's so nice.
Knew he was gonna do it.
Yeah, I love saying that. Okay. Okay, so any questions about that? Keep giving up with it, man. It's awesome. See, you made the mistake of telling me you hate that word.
I didn't tell you I hated that word. Just when you said that word, I cringed, and then you just kept on saying it because I didn't like the word.
I have a friend of mine, ex-Marine, right? We're out there, we're camping, we're hunting, we're doing all these manly things, right? He tells me how he hates cottage cheese, how if he just sees somebody eating it, he wants to puke, right? Next camping trip, I bought a bucket of it. Eat it right from it. That was awesome. Okay, Robbie, 16-year-old football player, was brought into his primary care physician by his mother, Janet. During football practice, he was complaining of shortness of breath. Robbie states during the summer he rarely gets short of breath, but during the winter his symptoms are worse. He lives in the highly populated city of San Francisco. Upon auscultation, his doctor noticed ronchi sounds. What is Robbie's diagnosis?
Although the ronchi sounds is really misleading, I think.
Why?
Because that's more like stuff is in your, like fluid is in your lungs.
It's
Like
a seal
wheezing,
makes.
right?
It sounded like a seal makes.
But that's not asthma, or am I wrong?
I don't know if you're wrong. I didn't write this. Let's look at it. Short of breath in the winter. Pollution too, San Francisco. Kind of sounds like asthma.
It is asthma.
I don't have any reason to believe it's not asthma.
I just think the ronchi sounds are misleading.
You do get mucusy when you have asthma.
Because you're like, it's irritating, right? So you can
Yeah. Here's the thing. Blah 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 blah. No, it doesn't say anything about that. If somebody's coughing enough, they might get ronchi sounds anyway, regardless of what they have. Because it's like a raw, seal-like noise. So again, I wouldn't overthink it. Just because there's one thing that might be slightly inconsistent, don't worry about it, because honestly, people are people, and they'll throw inconsistent crap at you all the time. Go with what most of it is, okay? Questions?
Nope.
25-year-old female walks into the clinic, says she has been coughing for the past week and a half. It's a lot of coughing. At first the cough was dry, but now she's coughing up moist mucus. She also started feeling chest pain, and she is congested. What brought her in was a high fever that started last night. She denies having any kind of respiratory history, except for the common cold of the past. What clinical manifestations would you not expect to see? That was a not question.
Well, barrel chest, of course,
Why?
because that's emphysema, and she has an infection.
Yeah. Right? You can get a barrel chest that fast, man. You should like go to the Olympics for bodybuilding. Your muscles can develop that fast. Okay? Question?
Yeah.
What? Not expect. Oh yeah. Okay. Yeah. Questions? Earl is a 52-year-old male that came into the ER complaining of difficulty breathing and a non-productive cough that caused him to have chest pain. When brought back to the triage nurse, Earl told her that he is a chronic smoker and smokes 1.5 packs of cigarettes per day for the past 23 years. Upon physical examination, the nurse noticed a clubbing of his fingers and a barrel chest. 23 years is long enough. It is apparent that Earl is having a difficult time expiring. Is that the right word? I think so.
Is that appropriate?
Is he having a difficult time dying? Yeah, that's what it sounds like.
Exhaling. Let's go with exhaling. Expiring air even worse.
If he smokes that much, you don't have
What other clinical manifestations would you expect to see?
Okay, those are not clinical manifestations. No.
No, who what?
That's treatment.
Who is?
Right there.
None of these are treatments?
Yes, the pursed lip breathing is a treatment, isn't it?
That's a simple.
And you don't make them do that, they do that on their own.
Well, you show them how to do it though.
No, they probably do that on their own.
Well, it says in your
In
thing.
my thing, I show them how to do it.
No, you said it helps them.
I showed you how to do it.
No, it helps with exhalation. That's what you said on your
It
PowerPoint.
does. It helps them get that
And you guys all
CO2
laugh.
out, but you don't have to show them how to do that. They do it anyway. That's actually something you would look for. If somebody's sitting forward like that, then look for that, because if you see that, they probably have what?
Yeah, emphysema.
Emphysema, right?
And the positioning is a treatment too. That's why I looked at it. That's a treatment too.
You can position somebody to diagnose somebody. It's still not a treatment. You could diagnose somebody by doing them in different positions. But again, if they're doing it on their own, that's still called ortho.
So that's considered clinical manifestation.
Yeah, if they're doing
Okay.
it on their own. Okay?
I don't know. It's more treatment to me.
Okay, now we got Janae confused. That goes. What now?
Yeah, can you go over that?